Hey everybody, welcome back to my channel. Today I'm going to be covering on why people fail out of nursing school and the things you can do to avoid failing out. So the reason why I'm making this video is because we need people in the healthcare field, specifically within nursing. Therefore, we don't want anybody to fail out of the programs. We want people to pass their exams and pass their NCLEX so they can go on and become a nurse. If you are new to my channel, make sure to give this video a like and subscribe. Also, never miss another one of my videos again. All you have to do is hit the bell down below. And with all that being said, let's get started. So as I mentioned, this video is specifically talking about where people make mistakes and it causes them to fail out of their courses, which leads them to fail out of the nursing program. So in this video, I'm going to be talking about the main reasons on why that happens. I'm not going to go in any specific order, but the first topic that I'm going to be talking about is the most important. And then after that, it really goes in a specific order. So let's get started. The first main reason on why people fail out of the nursing program is because people do not know how to study. Many people enter nursing straight out of high school because obviously they finish high school, they go to college, they want to do something in the healthcare field, so they choose nursing. They finish their 2 years of prerequisites, and then they apply for the program, and then they enter the program, and they're still in high school mode. High school mode, from what I remember, is more memorization. In high school, you are memorizing a lot. You're memorizing how to pass exams rather than understanding the material. So that is where the difference lies. In college, especially in nursing, you need to understand the concept before memorizing the content. Although there are some things in nursing school that you do need to memorize, but nursing school is mainly concept based. If you can understand the concept, you will do amazing on the exam. It's that simple. So how do you study, you ask? Well, luckily for you, I made a video specifically talking about that. I will put the link up here. So how do you understand the concepts within nursing? Well, there are many ways to do that. And if you watch the video, it goes more into depth, but I'll break it down for you. Pretty much, if you want to understand the concept behind nursing content, some advice that I can give you is watching videos, reading the textbook, understanding the difference between passive and active learning, understanding your study technique, such as making study sheets or making note cards. Also, something that is important is that by using active learning on the whiteboard, it allows you to drill that material within your head so you understand the whole concept. So if you're able to talk out the material, if you are able to teach that material to somebody else, guess what? You know the material. Therefore, you should be able to answer a question. And that goes to my other point. People do not do enough questions, especially critical thinking questions. Critical thinking questions are so very important within nursing because if you do not know how to answer a nursing question, it will cause you to do poorly on an exam. So there are plenty of sources that you can use to obtain questions, such as UWorld. You can also use Evolve. By you doing multiple questions a week, it helps you understand how to take nursing exams. Another issue that leads to poor grades is if you are struggling within a program and you aren't seeking help that you require in order for you to pass your exams, that is where students go downhill from there. Students who are struggling may not want to ask for help because there are many reasons behind that. Maybe they're too nervous, maybe they're too shy, maybe they just don't want the professor to think that they aren't smart enough Whatever the reason may be, sometimes students fail to seek help when they really need it. You are paying for your education, meaning if you need help within a certain area in nursing, it is your duty to go get that help, and you will receive that help if you ask for it. So it's important for you to speak up when you are struggling. That is the professor's job. The professor is there to help you. Something that I see a lot is that, from what I realize, that some students just come into class and they just do what they need to do and they just go home. And that's understandable. But at the same time, it's important to build a relationship with your classmates and also important to build a relationship with your professor. Don't just be another number in the class. Make sure to stick out as much as you can. The reason why sticking out is important in class is because when you are proving to yourself and everybody else, as well as the professor, that you are trying your absolute best, you are answering questions. When the professor asks a question, it's showing that you are there and you want to do your absolute best. Participating makes you known within your class, and guess what? You are paying for your education, so you should make the best of it as much as possible. So try to build that relationship with your professor and your classmates, because by building relationships, it allows you to build connections, and those connections lead to study groups. So it's very important for you to do that. Another reason why people struggle within nursing school is because, honestly, life just takes over. So what does this mean? By the time you go to nursing school, you are an adult, meaning you have to pay bills, you have to fund yourself. You are pretty much funding your own education. So that means you will have to work, and you may have children or you might be married. Therefore, life is going to take over. But that is where organization skills comes in. By having great organization skills, it allows you to organize your day where you can get all your content finished. So let's say if you do have children and you have to put them to sleep at a specific time, try to squeeze in maybe 3 or 4 hours after they fall asleep just to get in that extra studying done, or see if family could help out maybe on the weekends. I'm not a parent myself, but I do have friends that are married and do have kids, and they still figure out a way to balance out their school life, which is extremely incredible. And honestly, hats off to them. They figure out ways within their day to get their studying done. They organize their day accordingly so they can finish everything that needs to be done. So everything I told you today, make sure to really think about, especially if you're going into nursing school and you are worried that you might not be able to pass. So by following these guidelines, it will help you in the long run. If you enjoyed this video, make sure to give it a like and subscribe. And with all that being said, hopefully you enjoyed the video. And Tribe Nursing, signing out.